and preparing for outbreaks. And so part of outbreak management is preventing outbreaks from occurring in the first place, and then also having a solid plan in place for what to do in the event that COVID infections do occur in a school, in a workplace, or in a skilled nursing facility. So we're going to talk about a general framework for preventing COVID-19 infections in some of those common settings where outbreaks occur. Next slide, please. Okay, so prevention, it's a multifaceted and complex topic. CDC, CDPH, local health jurisdictions, they've released an abundance of guidance, which can be overwhelming and sometimes difficult to navigate. During this presentation, we selected some general concepts that are applicable in most settings and some of the most critical prevention strategies that you should be aware of as outbreak managers. So by the end of this presentation, we hope that you'll be able to describe some of those core public health measures to prevent and prepare for COVID transmission. This is the basic components of something we called individual control measures and screening as a means for keeping COVID infections out of some of these open or contained outbreak settings. We'd like you to be able to distinguish between the term cohorting, I'll do my air quotes here, cohorting in schools versus cohorting in skilled nursing facilities and also in correctional facilities. And at the end of this presentation, we're going to direct you towards some of the essential guidelines. As I mentioned, there are a lot of them out there, and there's too much detail for us to cover in this presentation. So we're going to send you on your way at the end of this training with some tips on where to look for some of the key guidance from CDC and CDPH to guide the work of outbreak management. Next slide, please. All right, Zoom poll. Can you launch the Zoom poll? So my question to you all is, since the first stay-at-home orders back in March towards the early part of this pandemic, which seems like ages ago, have you been working in person or have you been fully remote? Working in person, I mean going into an office, being in a shared workspace, working with other colleagues in physical proximity. What's your work setup been like since the start of this pandemic? Have you done your work in person, or have you been working remotely? All right, let's end the Zoom poll, please, Allie, and share the results. Okay, very interesting. It looks like half of you have been totally remote since the beginning, and about the other half of you have had at least some experience working in a physical shared space since the start of this pandemic. Next slide, please. Great. So for those of you who responded that you have been already working remotely, what's been some of the biggest challenges to maintaining a safe workplace since you've returned? For those of you who haven't yet returned to a workplace, what do you think will be some of the biggest challenges to returning to in-person work? If I could get some responses in the chat. What are some of the critical challenges that you access? Waking up early, great. Remaining socially distant. Yeah, waking up early, it's challenging to wake up early and then be expected to prevent COVID too when you go into the workplace so early in the morning. Commuting, okay, being social in general, social distancing, wearing PPE, getting everyone to follow guidelines, having a mask on all day. I'm with you there, and goes, yeah, that for me is very uncomfortable having a mask on all day. All of the above, commuting, okay, maintaining 6 feet. Thanks so much for responding in the chat, everybody. Next slide, please. Lots of challenges to remaining safe and healthy in the workplace and preventing COVID infections from occurring in shared spaces. Next slide, please. Okay. Thanks so much. So I want to return to this topic that Roz introduced of open and contained settings. So we know that certain settings are more or less open than other settings. For example, in a school where students and teachers and staff are coming and going every single day, that's a very open setting and lots of opportunities for infections to be transmitted coming in, within, and going out of that school-based setting. But then in a skilled nursing facility, for example, where staff may be coming and going every day, but most of the residents are relatively fixed and stay there for days or weeks or even months at a time, or have limited opportunities to enter and exit. However opened or however contained, I think it's always useful to think about how you can prevent infections from entering that setting, creating some sort of a barrier around the setting, or like a metaphorical barrier around the setting of transmission. How do you prevent those infections from coming in? Now, assuming that some infections will enter, should think about how do you prevent transmission within that setting, okay, within a skilled nursing facility or within a school-based setting or within a workplace, assuming that Some infections are going to enter at different time points. How do you prevent it from spreading within the setting? And then finally, how do you prevent infections from leaving the setting? When we think about contained and open settings, it's important to realize that a teacher, for example, may go into a school and at some point during the school day acquire a COVID infection while interacting with with students or other teachers, but then they go home at the end of the day. So preventing transmission, leaving those facilities from impacting the broader community is a critical part of outbreak management. Next slide, please. Let's start about talking about preventing outbreaks from entering. Okay, so one thing that we could do is don't let anybody enter, right? I mean, that's kind of the basic principle behind shelter in place. To prevent infections from getting in, we could simply close the door to everyone. So starting now, nobody comes in. If there are 0 COVID infections, for example, in an elementary school, and we immediately close the doors to all students, staff, and teachers, we can guarantee that no new infections will occur within that school because nobody's coming into close contact. But in real life, in the future that we aspire towards, that's not practical. Folks will continue to need long-term care in skilled nursing facilities and need to be admitted somewhere. We can't turn away all patients that require long-term care from entering the facilities, or else the other negative outcomes would be worse. The criminal justice system continues to function during a pandemic, and new justice-involved persons will continue to enter state prisons and county jails. Grocery stores remain open and need essential workers. So it's not a question so much of not letting everybody in, but one way to think about it is prevention strategies that can identify people who may have COVID infections and either preventing them from entering in some settings like schools or workplaces, or in other settings, letting them in, but with some extra care that we'll get into in the next slides. Next slide, please. Okay. So how can we prevent? What are the tools at our disposal from preventing those infections from initially entering into the facility? Symptom screening, that's one way to prevent, or at least reduce the likelihood that an infectious person will bring an infection into a school or workplace or a shelter or other outbreak settings. Symptom screening, it usually consists of some kind of a temperature check, like shown in this picture here with one of those thermometer guns, immediately before someone enters a workplace or a retail facility or a school. But it also involves asking people to self-screen, asking people if they or anyone in their home is exhibiting some of the common symptoms of COVID, including fever, cough, shortness of breath, and all the others that you're very familiar with at this point. Self-screening is recommended, especially for students and teachers in workplaces. And students and teachers in workplaces are asked to self-screen or screen under the guidance of a parent or guardian before they even leave the house. And those are a few different examples of symptom screening as a way to identify people who are potentially infectious from coming into a facility, by checking to see who might be symptomatic for COVID infection. Next slide, please. Oh, before going to the next, we'll continue to the next slide, but also a big caveat of symptom screening, of course, is that somewhere around 40% or even more of COVID infections are asymptomatic or pre-symptomatic. So symptom screening alone is most likely going to miss some infections that would kind of slip through that crack of defense if you're relying on symptom screening alone. So let me ask another question. If everybody could respond in the chat, in this chat slide. So symptom screening for employees, for example. If people are asked to self-screen at home and not come to work if they were feeling unwell, what's some of the reasons why they would not stay home? Okay, just respond in the chats. I'm seeing some dollar signs, loss of wages, can't afford to stay home. They may think it's just a common cold. They need money. They don't have any PTO, isolation, fear of eviction. Absolutely. There are so many different reasons why someone would not stay home. And we're going to get into that in a little bit more detail later. But having generous sick leave policies, educating workers about their rights under the Families First Coronavirus Response Act at the federal level, that's a critical part of training and education, is making sure that people know and have access to generous sick leave policies that would allow them to stay home. That's not always possible, for sure. And we'll get into that in a little bit more detail later. Next slide. Okay. Another way to prevent infections from entering is to test for COVID. Testing for COVID is another way to prevent or at least reduce the likelihood that an infectious person will bring a COVID infection into a school or into a workplace or into a shelter, a skilled nursing facility, other potential outbreak settings. I think by this point, we realized that it's certainly not practical to ask everyone coming into a school every day, students, to get tested before they leave the house or to get tested before entering a school. That's just not practical for many different logistical reasons. But some of the, the groups that we would recommend for testing would be, for example, patients who are newly admitted into a skilled nursing facility, especially those who are symptomatic at the time they're being discharged from a hospital or other place when they're entering. Patients newly admitted who are thought to have come in close contact with someone who tested positive. For example, someone leaving from a urgent care and acute care, and there's known transmission, we'd recommend if they were tested before entering the skilled nursing facility. Inmates entering correctional facilities. Right now, the guidance limits testing for inmates entering correctional facilities to those that are symptomatic or those that are likely to have come into close contact with someone who tested positive for COVID. But entering patients newly arriving into SNFs or testing inmates newly entering correctional facilities, that's a good way to limit the likelihood that someone will come into the facility with an infection that's unknown. We have different types of testing for schools, staffs and SNFs. It's something called surveillance testing. And I put some asterisks next to these because what we recommend that in schools, the guidance can be dependent on the local health jurisdiction and the Department of Education, but testing in schools of staff roughly once every 2 months as a way to identify infections before they get in is one strategy that's being used. For staff in skilled nursing facilities or correctional facilities, in the absence of an ongoing outbreak, you would recommend testing every 7 to 14 days as a way to routinely pick up infections that may be missed by other methods. And finally, testing close contacts of confirmed cases in the community through contact tracing is a good strategy for identifying workers who may be infected or students who may be infected before they enter into a school or a workplace and risk transmitting infection to others. Next slide, please. Okay, so let's talk about preventing transmission within a setting. So we understand that preventing everyone with COVID-19 from entering for school or workplace or other outbreak settings may not always be possible. As I mentioned, symptom screening with around 40% of infections asymptomatic is most likely going to miss a lot of cases. Testing everybody is infeasible, and sometimes that routine surveillance testing is also going to miss some infections. And there's some imperfect test accuracy that means a relatively small proportion of people with infectious COVID-19 would be missed. And then finally, while in schools and workplaces, persons who have a positive test result should be kept home, not attending school, not attending a workplace. In other settings, for example, shelters or skilled nursing facilities or correction facilities, we can't necessarily deny entry to someone who has a positive test result. We just have to make sure that that entry is very controlled in a way that separates people who are infectious or exposed from other people within that setting. We'll get to that in a few slides. So these are some of the general measures that we have at our disposal for preventing transmission within a setting, assuming that some number of infections will get within this contained or open membrane of our setting. Masking, general social distancing, hand hygiene and environmental cleaning, screening and testing, and cohorting. Cohorting in the context of schools and cohorting in the context of skilled nursing facilities and corrections, which we'll get to momentarily. Next slide, please. Okay, let's do a real quick Zoom poll about masking. Okay, let's do a real quick Zoom poll about masking. So who should wear face coverings during in-person learning at a school? This is just one group of the general population who should be wearing masks. So who should be wearing face coverings? The details, the devil is in the details with this question here. So is it all staff and students? All staff and all students except those with an exemption, all staff and all students except those under 2 years and older, 2 years with an exemption. Okay, I'll just give you another couple seconds to respond to the Zoom poll. Just respond to the Zoom poll. Of course, this is in the context of in-person learning, not remote learning. Can you share the results, please, Allie? Okay, great. So oftentimes you may find this is the trend in our Zoom polls. Sometimes when there's more information in the response option, that's probably likely the correct one. If you go to the next slide, please. So these are our general guidance for masks. And the correct answer is for students, all staff and students, except those under 2 years and those older than 2 years with an exemption. And so this slide talks about some of the general guidance for masking, not just in schools, but in workplaces in general, in public in general. So these are the general CDPH guidance for masks. Who needs to wear a mask? All students over 2 years old, workers in customer-facing industries, workers in office, factories, doctors, nurses, other healthcare professionals, other workers as dictated by industry guidance, and basically everybody who goes out in public, except children under 2 years old, and anyone with a medical condition or mental health condition or disability that doesn't allow them to wear a mask. And they might include people with trouble breathing or unable to remove the mask without help. By now, there is a lot of evidence out there that COVID-19 can be prevented. The respiratory droplets through which COVID is spread, the masks will create a barrier that can prevent droplets from entering the upper respiratory tract. It mainly prevents droplets exiting the mouths of people who have an active COVID infection. But now, as you surely heard, the CDC has updated their guidance, and there is evidence that says mask wearing, even face cloths, do protect the wearer, it's not just preventing from droplets exiting, but also preventing droplets from entering. Next slide, please. There are certain industries, especially in skilled nursing facilities and healthcare and healthcare services within correctional facilities, where special masks and other PPE are required. So we're talking about face masks, respirators, gowns, gloves, eye protection. So in those settings, a critical part of preventing transmission within that setting is planning in advance for adequate PPE. So that's for skilled nursing facilities, other long-term care facilities, and other healthcare settings, including healthcare settings in correctional facilities and including healthcare settings in a school. So for example, school nurse, if they are working with a student who is displaying signs and symptoms of COVID before they leave the building, those school nurses should also be using appropriate PPE. So this is a critical part that we're going to come back to, and your role as outbreak managers is working with some of these facilities to make sure that they have adequate stocks of PPE, and in the absence of adequate stocks, they get linked to the resources that may be available in your health department to help them get linked up to PPE. Next slide, please. Okay, general physical distancing. That's a good method for preventing transmission within settings. We know all about this now, the 6 feet of separation rule. If you've been into a shop recently, you've probably seen physical partitions or physical cues, like those lines on the floor that tell you where to stand while you're waiting in line. In office spaces, that means reconfiguring desks, and in classrooms, reconfiguring desks and spaces so that 6 feet of separation can be maintained. When we are in many settings, schools, workplaces, correctional facilities, SNFs, closing or restricting common areas like break rooms and rec rooms is a strategy for physical distancing. Having directional hallways for passageways to make sure that people are only heading in one direction, so it reduces the likelihood that they'll cross paths with someone in the other direction. Staggering breaks in workplaces or recess in schools or lunch. And the same goes for correctional facilities and skilled nursing facilities. If there are activities in correctional facilities like shower time, for example, or yard time or exercise or work, making sure that those times are staggered so that it decreases the likelihood that people will be coming in contact with one another. Next slide, please. Let's talk a little bit about cohorting, or potting is another term that you might have heard in schools. So cohorting, it's a social distance strategy. It essentially creates groups of students, teachers, and staff that stay together throughout the course of the day. So it's an attempt to minimize exposure across the school environment. If you have small groups of people who are doing their own thing throughout the course of the day and going from the start to the end of the day, separate from the other groups, it's reducing the likelihood that people across the school environment will come in close contact with one another. Students and staff should only have physical proximity with others in the same cohort. We'll get into this later in Alex's presentation, but cohorting is also a really great way to keep track of infection, so that if there is an infection that arises somewhere in the school, hopefully that transmission chain will only impact one cohort while other cohorts can continue with in-person learning. Next slide, please. Cohort's a little bit different in skilled nursing facilities and also in corrections. So in skilled nursing facilities and corrections, cohorting is a strategy that also is a type of social distance strategy, but this one is more targeted. So beyond general social distancing, it takes into account residents' exposure and infection status. So in skilled nursing facilities and corrections, in advance of a COVID outbreak, these facilities are required to have dedicated space within their building so that if a COVID infection is identified within the facility, those people with a positive test result can be physically relocated to the red zone, or that area, what's called also the isolation unit, where only other people with COVID infections are kept. And the yellow zone is for residents who are quarantining. So those are for people who are exposed or have a negative test result within the last 14 days. And then green zones would be those areas where everyone else, so someone who have a negative test result without any known exposure in the last 14 days. And so this idea of cohorting in skilled nursing facilities is about separating people based on their infection or exposure status to limit the likelihood of exposure and transmission to the broader population within the facility. Next slide. Okay, so preventing transmission within, again, screening and testing. So all of these different facilities, especially those that involve residents, skilled nursing facilities or inmates corrections or residents of SROs, doing routine symptom screening is a way to identify and test for COVID infections. So for schools, doing symptom monitoring during the work or school day, daily symptom screening for existing residents of SNFs with immediate testing for those who are symptomatic, something called response-driven testing, which is after, in skilled nursing facilities, for example, as soon as one or more COVID infections are identified, that would trigger a response-driven testing where everybody in the facility is tested to identify new infections, and that would be repeated every 7 days until new cases are identified. And we'll get into that in monitoring. And then, of course, testing of all close contacts through contact tracing or location-based contact investigations. Okay, I'm just going to touch on this very, very briefly. Next slide, please. So Dr. Raz mentioned that a very limited number of infections can be transmitted via surfaces. So hand hygiene is critical, making sure that hand washing stations, hand sanitizers are available throughout a workplace or available throughout a school, and especially available in places like correctional facilities, whereby incarcerated persons, their ability to protect themselves really depends on the supplies and physical setting that is provided to them within a jail or correctional facility. So promoting healthy hygiene practices is a critical part of preventing transmission within facilities. Next slide. Similarly, having enhanced or intensified cleaning schedules for disinfection and ventilation to make sure, especially that after those locations where a COVID infection was identified, that those spaces are targeted for enhanced and intensive cleaning to make sure that all of those surfaces that may have been contaminated are quickly disinfected and decontaminated. Next slide, please. Okay. Finally, we want to talk about how do we prevent infections from exiting a facility? Can we prevent everyone from leaving? No, that's not really feasible. If you imagine somebody who displays symptoms of COVID infection during the workday or during the school day, it wouldn't be feasible for that person to remain in the facility until their infection resolves. Can you prevent only people with COVID-19 from exiting? Again, also not feasible. You may be surprised to learn that incarcerated persons who have COVID-19 infection and are isolating when they're scheduled to be released they are still released back into the community. So in most correctional settings, you would not keep an incarcerated person incarcerated if they were scheduled to be released, even while they're still isolating. So it's about managing that release back into the community or discharge from a skilled nursing facility elsewhere in a safe way. Next slide, please. Okay, just a couple more. So once again, I've hammered this on 3 times already, but symptom screening. It's so critical in order for people who are leaving a setting to be able to protect themselves and protect other people in their community by isolating or quarantining themselves or having supportive isolation and quarantine. Symptom screening with immediate testing for those with symptoms, response-driven testing, and testing of close contacts in order to limit the likelihood that people who acquire an infection will leave that setting without knowing that they are infected. Next slide. All right, just a couple more to go. Great. So a key part of prevention is training and education of staff, residents, and other stakeholders. So it's the responsibility of all employers to make sure that all workers have a basic understanding of COVID-19, how a disease spreads, what are the symptoms and ways to prevent and minimize that spread. So we're talking about students, we're talking about teachers, other staff working at schools, employees of different workplaces, contractors, nurses and technicians working at skilled nursing facilities, correctional facilities, officers. It's the responsibility of the workplace to ensure that all of the stakeholders in the setting are educated on what's being planned to prevent COVID transmission, and critically, the importance of not coming to work when people are sick, symptomatic, or potentially exposed. Next slide, please. Preparing to prevent transmission inside of a setting out to the broader community is preparing in advance to respond to cases. And that means assigning a dedicated infection preventionist or a site liaison, whether at a school or a skilled nursing facility or workplace. Somebody needs to be in charge of overseeing the COVID prevention plan and liaising with persons of contact at the local health department. So preparing for those things in advance. Facilities that know who their person of contact is at the local health department will be much more readily able to jump in and respond when cases are identified. Next slide, please. Okay, this is it. This is the very last slide. So we're going to talk about written COVID prevention plans. CDPH, California Department of Public Health, requires that all employers implement and update periodically a COVID preparedness, response, and control plan. That is a plan that's specific to their workplace or industry. Skilled nursing facilities are required to draft and submit COVID mitigation plans to the California Department of Public Health. Schools are required to submit to the local health jurisdiction before reopening. And correctional facilities have plans that are overseen by the California Department of Corrections or by the county sheriff's office and the local health department. So critically, those plans need to be written. They need to be written down somewhere. Okay, last slide, and then we'll go into our breakout group activity. I just wanted to highlight this here in the PowerPoint presentations that are available on Google Classroom. This is a list of some of the critical guidance that will be useful for you to familiarize yourself with. And that's what this presentation has been based on. Workplaces, schools, people experiencing homelessness, skilled nursing facilities, they all have specific guidance from California Department of Public Health, from CDC, and from other groups. And when you open this presentation in Google Classroom, you'll see that we've included links to all of these documents. So we certainly don't expect you by the end of this training to go in and familiarize and learn by heart all of the details of these, but we wanted to point you in the right direction and encourage you to start becoming familiar with some of these guidance documents so that you can really understand the context of what different sites and different industries are doing to prepare and prevent for COVID infections. Okay, Ali, you can stop sharing the screen.